My name is John Donadieu from Paris. I am a pediatric hemato-oncologist, and I am also a statistician or epidemiologist, and I am in charge of the French registry for congenital neutropenia in France. We recently published a paper on this because we were surprised to see this HPV-related cancer, which is the most frequent one in WHIM. We know that there is a lot of HPV in this group of patients, but we were badly surprised to see that some of these warts may turn in cancer. And this is a genital cancer or anal cancer, and it is a bad way to have a cancer because such cancer should be treated by surgery, by radiotherapy, and it's not an easy way to cure such cancer, which can have some deadly consequence. So we have this group of patients, but we know also, and we have observed also that there is some other kind of cancer, mainly lymphoma. And lymphoma can be related to some virus like Epstein-Barr virus, EBV, which can be the trigger of this virus in this group of patients, like what we call Hodgkin disease. So we have lymphoma, Hodgkin disease, or non-Hodgkin lymphoma. And lastly, we may have some other more rare cancer. But most of the cancer are carcinoma related to HPV and lymphoma related to virus and mainly EBV. So this is a major group of cancer observed in this patient. I can just add that we observed this before age of 40. And before age of 40 is early in life, which is completely unusual to have such high frequency of malignancy before age of 40. And that's a testimony of the weakness of this group of patients with regard to virus and to cancer-related virus. The HPV are not so complex to screen, and I think that women have to be followed by a gynecologist for this kind of cancer. Also, as a physician, you have to look on the critical area, which is the perianal area and the genital area. But it's determinant to have this follow-up or to organize this follow-up. And the second, with regard to lymphoma, it's more difficult because you can just follow the ABV in the blood, like ABV PCR or things like that. But most of them occur in an acute way. So it's not so easy to prevent the lymphoma. HPV can be preventable. EBV and lymphoma are not so easy to prevent. When we look to our cohort, because we have set up a cohort of patients in France, so we collect the information of the different patients followed in France in different centers. We try to collect this information close to the patient. And globally, we observe that life expectation is limited in this group of patients because if you accumulated the infection, the cancer, the life expectation is hampered by age of 40. And so we lost about 1/3 of the patient before age of 40. We lost about 2/3 of the patient by age of 60. It's not death in the childhood, but it is death in adulthood, and this can be preventable. But presently, such group of patients have a limited life expectation, which is a concern.